Hi, I'm Alex Howard, and welcome to the second video in this series of videos making sense of ME, chronic fatigue and fibromyalgia. Now, in the first video, we talked a little bit about my background, some of the story behind the Optimal Health Clinic, and also I introduced the idea of the integral approach to ME, chronic fatigue and fibromyalgia. And hopefully you had a chance to read a bit more about that in one of our academic papers where we introduced some of these ideas. Now, in this second video, I want to talk to you about the stages of recovery that people tend to go through in ME, chronic fatigue and fibromyalgia. Now, the reason why these stages are so important is people tend to get stuck at certain stages of recovery. Depending upon what stage somebody is at, we find different approaches tend to be more effective. Now, most practitioners and most people working with ME, chronic fatigue, fibromyalgia, they come from a kind of one-size-fits-all approach. So if you have somebody which is working from a traditional medical point of view, for example, if they're an immunologist, they will simply look at your immune system. If you have somebody who is perhaps working from a psychology or CBT perspective, they would just look at your cognitive behavioral therapy, so you look at your belief systems. If you're working with somebody who's a traditional trained nutritionist, they will probably just look at basic diet and supplements. Now, these things can all have their place, but the important thing is not just understanding what approaches to use, it's understanding when to use which approaches. So which stages of recovery, or which stage of recovery, somebody is at. Now, the three stages as we define them are stage 1, the crash stage, stage 2, the tired and wired stage, and stage 3, the reintegration phase. Now, at stage 1, the crash phase, at that point, the single most important thing is having rest and having quality rest. Now, one of the key kind of warning signs that somebody is in this phase is people will need a lot of sleep and they'll actually be able to have lots of sleep, as opposed to some of the other stages where actually people find sleeping becomes more difficult. People tend to go through stage 1 at the start of their illness. Now, some people have a gradual onset, for other people it's a sudden onset, but there tends to be a point where people have to stop and do basically nothing. Some people stay in this stage for a long time, by the way, if they haven't got the right ways to support them out of it. But people are in that stage and they do nothing, you have quality rest, and what should start to happen, if it doesn't, there are reasons and there are ways of working with that. What should start to happen is we come out of stage 1 into stage 2. Now, we know somebody's coming into stage 2 when we start to notice they're not sleeping as much, even though they may feel like they want to sleep. So you get this kind of tired and wired feeling. And in that tired and wired feeling, it's like you're tired and you feel exhausted, but like you can't rest. And it's like in that stage, some of your energy has started to come back, but it started to go into your nervous system. So you start to get more of that anxious and irritable state. Now, some people don't even recognize that's what's happening. Sometimes we need an outside perspective to see that. But there are some, as I say, some key differences here in these stages. In stage 3, what starts to happen is we have perhaps a little bit less of the anxiety, but we find ourselves in a place where we're at a kind of glass ceiling, where it's like we've got our pacing in place, we've dealt with some of the physical things that are happening, we've done some psychology work, but we never seem to get past a certain point. And in that reintegration phase, again, there are different ways that we need to work with that. There are reasons why. And I think one of the important things to understand is if we're stuck on our recovery path, or we're relapsing, or we feel like we're not moving forwards, there have to be reasons. And in a sense, part of our job is to act like detectives, and having, say, worked with thousands of people in 35 countries, start to get very good at recognizing what's happening, why it's happening, and what we can start to do about that. So, depending upon which stage we're at, as I say, there are different ways of working with that. Now, you may have a bit of an idea of some of the ways that we work at the clinic. I'm not going to go into a lot of detail in these videos about that, but we basically have a medical director providing a diagnostic service, and then we have a psychology department and a nutrition department. And at each of these stages, there are different ways we work with that. And you can get a bit more of a sense of some of what I'm talking about here in an article that you can download underneath this video. And that's an article on pacing, which we wrote, I think, about 3 or 4 years ago now, but all the information in there still stands up. And it talks more about these stages, gives you more of an idea of what's going to be appropriate, what's going to be helpful at certain stages. And it also talks about the whole concept of pacing, because chances are, if you're watching this video, you will have heard of pacing, you may have tried pacing, you may have had a complete nightmare with pacing. But again, there are some refinements in the understanding of that, which I think you'll find particularly helpful. So I want to encourage you to download, or you can just click on the link and read that article. And if you've got any questions at all about how this may relate to your situation, again, remember you can book a free 15-minute chat with one of the practitioners. There's no pressure, there's no kind of obligation to do anything else. It's simply a way to get your questions answered. So we'd love to have a chance to talk to you in one of those 15-minute chats. And then in the third video, which will come out in a couple of days' time, I want to talk to you about the 7 subgroups. So these are 7 different subgroups that can be happening. Some people have all of those, some have some of them. Again, it's very important in understanding those to help us then work out what kinds of interventions, what kinds of ways are going to be appropriate. So I look forward to talking with you on that video in a couple of days, and thank you for watching.